Hello, it's Adam from the Rural Health Transformation Hub, and welcome along to another webinar. I'm really excited about this one because we've got over 90 attendees signed up. Hi, Mum, if you're watching. And I hope it's going to be edifying and helpful for you as you go through your Rural Health Transformation Program application or planning implementation. We've seen a lot of states already releasing their RFPs. We know Alaska's letter of interest deadline has passed a couple of weeks ago, and this is all getting rolling, and it's becoming quite real and coming down the line quite soon. So in this webinar, I intend to talk to you about why Rural Health Transformation Program applicants should start seeking contractors now to stay compliant. And if you're watching this, maybe you have already applied or you're thinking about applying, but this is going to be useful for you because we know that in big grant programs like this, it's difficult to implement successfully without bringing in outside help. So much use of the word generational has been used to describe this program. And we know that rural health has been chronically underfunded for years. And it's only going to get worse with this administration's cuts to Medicaid. So I've got a stat for you. In 40 Medicaid expansion states, federal funding cuts could lead to an average of 19% decline in operating margins, and that rises to 56% for safety net facilities. In rural health, we need to get this grant program right. We need to prove that rural can create results and that it's not a money pit, that with government investment, health outcomes can be improved, lower the cost burden of chronic illness, and improve access to care system-wide. This is a generational funding opportunity, but also a generational opportunity to prove that funding belongs in rural healthcare and should be increased and not decreased. So let's not waste it. Before we get started, I'd love to see you on LinkedIn or YouTube. Put where in the country you're joining from. And why should you listen to me? Well, hi, I'm Adam Chambers. I've been working in rural health since 2019 through my company's nurse recruitment experts and Applicants. We've served 175 clients across the US. Some examples of our clients are on the screen. And this is important for me because our rural health clients have really been gems and are really doing important work in their communities. But a big gap to them succeeding has always been funding. So whenever I saw this 50 billion coming into rural health, I saw an opportunity to help providers like our clients set up a rural health transformation hub that gives free guidance on how to navigate this program, how to win the funds, and how to implement programs successfully, and ultimately to improve health outcomes for rural. One of our proudest achievements is getting 20 nurses to accept job offers with search, you can see on the screen, in Southeast Alaska, saving them potentially $10 million across 5 years. So my topic today is why you should seek contractors now. I'm going to be speaking about why you should seek contractors, first of all, and then I'll go on to talk about why it should be now. Not tomorrow, now. So states must obligate their funds through this program by October 2026. So that's going to be $10 billion across the country, an average of 200 million per state that is going to be obligated to healthcare providers like you or directly to vendors who will do technology programs. What does obligate mean? Well, that means that the state signs a contract with you and says, you're going to get these funds across year one of the federal financial year of the program, and you're going to spend it in a certain way. So thanks to Zoya on the LinkedIn who corrected me on this, it's not you have to sign contracts with your vendors, but it's that the state has to decide who they want to give the money to. And you will have until September 2027 to spend this money. So we're about 18 months out from that date. And a couple of weeks ago, I was at the Northwest Rural Health Conference in beautiful Spokane. And I met a lady from the Department of Health who raised a question that her procurement process on its own is 6 months. And Washington hasn't released an RFP yet. So let's say Washington released an RFP in May and they award funds in June. If that procurement process can't be sped up, 6 months from June is December. Scratch it off for Christmas. We're in January. She's only really got 8 months to spend that year one money. That's a 12-month program that's to be compressed into 8 months. That's not ideal. So I'm going to share you a little video just from a webinar from Kansas where they talk about this.
A lot of your organizations probably will not be able to carry out every single thing yourselves. So that's going to require you to go out and contract.
Yeah, so not just me saying this to try and sell stuff. This is a common thing that you're going to have to contract stuff. Now, a big part why you should contract parts of your RHTP grant is on expertise. So it goes without saying that vendors exist to solve problems that require highly technical expertise, which is not financially viable to have in-house. For example, you don't have usually website developers, app developers, or a large team of digital marketing people in a small rural health clinic. We can go a step further and talk about AI platforms, software services, and things that could never really be done in-house and require a whole organizational structure to fulfill them. All these exist because people are trained and specialized in their areas and the market needs them. So we live in an economy really of subject matter experts. The more trained and experienced you are in your role, the more value you provide in this colony of ants where everyone has their own specific task. And I don't know if you could see that. I'll remove myself from the screen if let's move on to resources. So most rural healthcare providers are overworked and understaffed. And there's a capacity strain in taking the owner of a rural health clinic, the department leader, or another key team member into non-core business activities. This funding is meant to be startup money to launch new initiatives. Think of it as an investment in your rural healthcare provision or your community. The investors, which is the state and CMS, the feds, are going to expect a return on their investment. And as we know with all startups, it's often the founder who is putting in those 12-hour days. Once they get investment, putting in 14, 15-hour days to make it work and turn it into growth. So fair enough if you put your core team on this because it might be a big grant relative to your revenue, but you're going to need to replace them internally, and that's not funded by the program. So the program, it can pay for existing staff to work on it, but you're going to have to replace them in some way. Ideally, the program will be used to bring in new staff or contractors who can work on it. On that point, the alternative to using contractors is hiring someone on a short-term contract. So it could be 12-month contract, they come into the office or they work remotely. Some of the pros of this include that you're creating jobs in your local community. Someone in the office you can swivel around to, hold accountable, and forms part of the core team. But some of the cons are it's hard to get rid of them if it's not working out. It could be underperformance issues that will be difficult to fix through a rapid kind of timeline, that 8 to 9 month timeline. Could be a lack of specialization. If you bring in an agency, you've got a graphic designer, you've got a web designer, you've got an account manager, you've got a Facebook ad specialist, all working under the same price. It's hard to find that in one person. And ultimately, this is up to you. I'm not saying don't hire people to work on your program, but just consider the pros and cons, and that bringing in a contractor on a 7 to 8 month contract could be a lot more flexible than putting out a formal job description and bringing someone into your team only for 8 to 9 months of the first year. Now let's talk about now. Why seek contractors now if you haven't applied to the program perhaps, or if you're in Alaska, you've applied, but it's not 4 to 6 weeks until the state gets back to us. Well, back to my earlier point that the funds need to be spent by September 2027. So if you do have an internal procurement process, which takes a while, you're not going to want to wait 4 or 5 months to kick that off. We've seen in Oregon, for example, we're part of 3 frameworks with the health authority to provide technical assistance, training, report writing. And we've already gone through the filtering process where we had to make a formal response to their RFP. We told them all about us, they did their due diligence, we signed a contract with our pricing. And now, if one of their partnered agencies or offices has need of a contract of a certain amount, so not a massive amount, but a good value contracts, then they can go to the group of vendors on this framework and say, we want to work for these guys, or we want to do a short procurement where the vendors just need to put in 3 pages. And it just speeds up that process. The vendors have already been pre-vetted. So if you are a local public health department or a government agency, you can consider that route. But even if you're not, I think it's important to match up a few things before you jump into bed with them on the Rural Health Transformation Program, because you need to choose the right vendors. If you don't choose the right vendors who are going to be doing a lot of your work, then you might not be successful. And that's not great. So I'm going to share with you an example of something that happened in Manitoba where the state got money to recruit 150 doctors. So they recruited an agency called Canadian Health Labs to do it, but Canadian Health Labs only got them 2 doctors. That was a bit embarrassing for the state and for the recruitment company involved, and you don't want that to happen to you. As I said at the start, generational opportunity might not come around again. If you don't get it right in the first year, not only will the first year funds be spurned, it also puts in jeopardy your opportunity to get funding in year 2 to 5. So that's 80% of the funding. So state of Manitoba goes to the Canadian, do they call them a federal government? Probably not. They go to Ottawa and say, we want money to get doctors. They get 2 doctors out of a target 150. It's unlikely that Ottawa's going to throw more money on that in the future. I will say for Canadian Health Labs, this looks like it was a contingency recruiting contract. So they only got paid when they hired people. So yeah, not to throw shade on them. I know that contingency recruiting is quite hard and it's disincentivizing to the vendors. So that's a point that I should probably mention though. If you are engaging contractors, pay them a fair amount if you want to get the work to be completed. And I wouldn't go into contingency of success-based contracts here, because if they don't get the result for you, you're going to end up with that money at the end of the reporting period. Maybe you've signed an agreement to spend it on a certain area. You're going to have to hand it back. It's not like you get to pocket that money and you're saving money. So it's better if you're working with someone who's working on workforce or marketing to just say, here's the money we want, here's money we're going to give you, and here's the result that we want. Here's another one where things didn't go as planned. The Rural Digital Opportunity Fund, as of 2023, more than 25% of funds had gone into default because results were not achieved and programs were not rolled out effectively. There is a risk for your state here called clawback, where if they don't spend all the money allotted to them in year one, the feds will come and say, give us back that money. And they'll have to give it back to them, and it'll be given to other states, and it'll reduce their chances of getting equal or greater funding in year two. So for your state, it's really important that you can find the right people who will help you spend this money effectively. Another one is getting free ideas. So even if you're just at that building your application stage, vendors are specialists in their market. So they're connected to each other, your competitors, your neighbors, and perhaps you. They know what's up. It's their job. So you can get consultation from them, ask them what they're seeing others doing, bounce your ideas off them, find out what's affordable, so what you're going to put into your budget, what's practical, and what isn't. You can get a lot of free ideas from contractors at this stage while you're building a pre-vetted list of people that you'll go back to when you know what funding you're going to get or potentially get, and then sign contracts with them. Another point is, what else are you doing? So if you've already submitted or you're thinking about submitting, I think partnerships are a very important part of implementing this. And if you're going to be contracting out 30%, it's a really key thing to be considering at any stage of the program, because it's integral to the nature and design of the program. Finally, I mentioned at the start the procurement process. So is it 3 months, 6 months, 9 months, or is it 1 month? I think any procurement process you need to go to needs to be analyzed and dissected. So we had worked with a local public health authority in the past in their application to a government grant. They went through, they were awarded a good chunk of money. I think it was like worth 10% of what their annual budget was, which was a lot for them. And then their board of commissioners shot it down. They said, we don't want you to get this money. That was per planning from both sides on what their procurement process actually was and to what extent they had to be involved. So look at your procurement process anyway. If it's just you makes the decision, then you can decrease this timeline. But if it's more than one of the person or it's politicians involved, be careful and figure out what you have to do. So I promised that I would share how to screen and vet the right contractors to match your RHTP plans. So here's a few things that you might want to make a tick box exercise of. Have they worked with a state or federal contract before? Do they understand procurement and compliance requirements related to those contracts? Are they registered on sam.gov? Or are you going to have to teach them how all this government contract stuff works as you go through the work? Going back to the webinar that the state of Kansas did last month, which is very helpful, by the way, if you just look it up on YouTube, Kansas Department of Health, they spoke about how sub-awardees of the grant are going to be held to the same standard as awardees. So the awardees are the states. So state of Alaska, if you get a grant from the state of Alaska, you're a sub-awardee. So you have to stick to the same procurement requirements. I can't quite find it on my sheet here, but the same procurement requirements as the state would have, the same compliance, the same reporting. You need to really look at the admin side of this. So you're going to want to work with people that understand government contracting, understand, and maybe can even teach you how you can report back to the federal authorities or to the state authority and do it in a compliant way. I would say there are benefits to working with, the marketing agency, who's local and integrated in the community, or the local accountant, certainly. But you don't want to miss the expertise that larger organizations or larger agencies that have nationwide experience can bring when it comes to getting this right in year one. We have worked with Oregon Department of Human Services, for example. Procurement process was probably 3 months. Reporting was very particular on what we had to share with them on a certain date. And we understand how to report back to the Oregon Department of Human Services and the Oregon Health Authority. That's not an easy learning curve. So bear in mind who has a contract to work with when it comes to state or federal opportunities. Next, are they willing to work with you on the contract terms? So particularly tech vendors, like if you're going to a tech vendor and saying, we've got a year program, what can you do on a trial contract where we lease a service for 9 months because we're starting a few months late? If they say, oh, sorry, all our contracts are 18 months, you can do your 9 months, but you have to keep paying us. Wouldn't be doing that myself, because you don't know if the money's going to be about in the second year. And the last thing you need is to be signed into an 18-month contract with a vendor, but you're not getting any revenue to fund your collaboration. So work with people that want to be flexible and understand how this program works, and are willing, for example, to sign on whenever you get your grant agreement and you're definitely getting the money, or they're willing to be flexible with the payment terms until you get your money. And the market is big. There should be at least one competitor for each service, be that EHR, be that compliance platforms, certification platforms. If there's a market, there's going to be competitors. So shop around, and that's why you should start early as well. Have they achieved results in rural healthcare in their niche before, or their niche, as you would say in America? For who? And could that apply to your market? So it doesn't necessarily have to be the next rural critical access hospital down the line, but have they some experience in rural health? Do they know what it means to work in your state? Do they know, for example, if we're talking about Alaska, the nuances of there being a tribal health system? Do they know what a hub and spoke model is, or are they complete newbies to this who are in like San Francisco or Los Angeles? You want to connect with that person in the organization, or connect with an organization that has worked with rural healthcare clients before. Next one's a big one. Are they debarred? So the federal government maintains a public list of all entities that are banned from receiving federal funds. It's not going to look great if you get an award and then you start billing and it turns out that either the state recognizes, or through an audit recognize, that company that you work with isn't allowed to get access to federal funds, or they're not allowed access to state funds because they're, for example, boycotting Israel, or they're trading with Iran. Very unlikely that's happening, but I've seen that state procurement and federal procurement laws are quite strict on these things. Every time we make a proposal, we have to say that we're not trading with Iran. So do your due diligence, and then think, do they have some knowledge about the rural health transformation program? Or again, are you going to have to educate them on it? Are you going to be a teacher, or are you going to be a student of the vendor? Which would you prefer? And finally, for this, will they help in transformation in other areas of the grant? So if you're bringing in a marketing agency to engage your public or engage your workforce, are they going to help you stay compliant? Do they know about cybersecurity? Are they going to help keep your data safe? Are they able to chip into project management and strategy? And just like whenever you get on that weekly call with them, again, are you learning from them? Are they viewing your program holistically and giving you advice and chipping in to it as well? Do they want you to succeed across this program? And do they want you to get funding in years 2 to 5, or they just want money in year 1? Now, Some priority areas you might want to think about outsourcing. Public engagement, marketing. This is a huge one, I think, to make your program successful. Build it and they will come is a fallacy. So I spoke about telehealth, could also speak about recruitment. Think about how your recruitment is going at the moment. Is it going well? Okay, maybe not. So if you make a new apprenticeship position or a new training program, or you're opening up a training center, or you even want to do a recruitment bonus for a physician, how are you going to take that to the public and get them into it? It might be a great offer, and I do think that great offers solve a lot of problems when it comes to marketing. And this program really is giving great offers. So, for example, Iowa, 100,000 plus sign-up bonuses for nurses or doctors. That's a lot, but you need to communicate it anyway. So, going back to that sign-on bonus, if a hospital with 10 nurses is advertising a job with $100,000 sign-on bonus, you need to communicate to your 10 nurses why that's happening and why they're not getting it. This is not as simple as just launching a program and then getting results. You need to think about it holistically. And often you're going to need to bring in experts that can help you do that, be it PR, marketing, or recruiting. Another one is reporting. So have you got a federal grant of this scale before? Do you know all the ways to structure data, to structure metrics that you would be reporting back? That's a good thing to bring someone in on the admin side or compliance side, and not just someone that tells you how to be compliant, but helps you be compliant by helping you get the result and then presenting the result in the right way. That's the ideal, rather than paying an agency that's like, we're the compliance agency and we'll tell you how to be compliant. It's like, no, I need to get the results to be compliant and have the vendor that's helping me get those results report them back in a way which then I can report back to the state in an easy to digest and compliant way. What to keep in-house? Well, procurement is a good one. We have seen some of the states bring in vendors to help with their procurement process. So State of Alaska's brought in the Alaska Community Foundation to help filter through applications, sort through them, like recommend who to go for. But the ultimate deciders are going to be a committee from key community partners in the state, from the Department of Health. You don't really want to outsource your procurement because that's a core function and it's make or break if you get the right people in or the wrong people. And then main project staffing. So who's your internal project manager? I'm not sure, but I'm doubtful that you can get a grant and then just outsource 100% of it. Like, you're going to need to staff it up with team members. Maybe you're going to need to hire some people and have those that are accountable to your organization on this. Maybe an old hand or two that's been around the block with your organization, has won a grant or two before, knows the way around the hospital or the health system or the clinic, and can step in whenever things aren't going to plan. So yeah, I'm not saying outsource everything, that's bad. Keep it in-house. So I want to finish with a belief I want to share with you, that I know in rural healthcare at the moment, there's a lot of concern about cuts coming from HR1, particularly to Medicaid and the rise in the uninsured population. And I've also seen a lot of doom and gloom about how this program isn't going to make up for those cuts. And I absolutely agree with that. I think that we who are working in rural health need to keep advocating with politicians, state representatives, people on the Hill, to get more money into rural care and to tackle these cuts in any way that we can. But as I said at the start, this is also a chance to prove that rural healthcare is deserved of funding. And if we can get this right, if you can get this right in your particular state, then that's one of the strongest ways that you can advocate, by proving that investment can be turned into positive overwhelming returns. And also, I think, as I said, this is startup money. This is a way to open up new revenue streams for your organization. So turning those programs that you create into drivers of new patient engagement and revenue. If it is a telehealth program, reaching to people that wouldn't be keen on coming into your clinic, but would be open for a telehealth visit, or indeed to people who are further outside your service area. If it's a tech innovation solution, how can you bring wearables, for example, to your community that they would then pay for, that can tick up your patient revenue? When it comes to costs, around 50% of costs for a rural hospital is on staffing, particularly nurses, physicians, APPs. Can you use workforce initiatives to reduce those costs and retention initiatives to keep people longer and reduce the cost of replacing them, which is in the tens of thousands? If you can do those two things, increase revenue, reduce staffing costs, you will have a positive effect on net margins sustainably for long term. And the big thing here is to make sure that you spend the money. So engage contractors at the right time, start now, so that you know who will be able to do good work for you, get the results that you want when it comes to access to care and patient revenue, reducing staffing costs, but also help you stay compliant within the program and reduce the chance of any clawback having to send money back to your state. And then the state have to send it back to the feds. If you want to learn more about what we do, then you can talk to my colleague, Dr. Michael Fitzmaurice. Just search hub.nurserecruitmentx.com or visit my LinkedIn, Adam Chambers, and you'll find it. Our role in all of this is, as a contractor, to help our clients' RHTP dollars go 5 times further. And we do that through our workforce and patient engagement system that utilizes cutting-edge marketing techniques to help you understand, and patients and workers understand, what makes your program novel, interesting, and worth participating in. Creative marketing to get it out to them, and 5x the number of people who would have seen your program to increase by 500% the views, the clicks, the impressions on it, and then help you convert them into patients through phone follow-ups, website development, and text and email marketing sequences. Really just push people down the funnel, drive them into your programs, get them to convert, get those new hires into your training program, for example, or get those new patients onto your telehealth offering. Ultimately, to help you make success of this program, avoid making clawbacks, and have a long-term effect on access to care, and eliminate any chance of a clawback. So I've been Adam Chambers. I hope you find this useful. You can visit the Rural Health Transformation Hub for more, or check out hub.nurserecruitmentx.com to chat with Dr. Michael Fitzmaurice, my partner. And we've got another webinar next week with Chastine Lynch up in Alaska. We'll be talking about project management essentials for your rural health transformation program, how you can plan things out, achieve those metrics that you want to achieve, make sure everything is well organized and there's clear guidelines and guardrails for implementation from start to finish. Thank you for watching, and I wish you all the best with your program design and grant applications.